Gentlemen, you are both drunk on cosmic wine.
Welcome to the show. I'm Dr. Mark Sylvester.
And I'm Dr. Richard Schulman. This is Alt Psych.
Welcome, everyone, to the show. As promised, this week we have a very special guest. It's Dr. Martina Mallory of White Sands Dentistry in Bradenton, Florida. Welcome.
Thank you very much.
So we're going to be talking about some really cool stuff today, stuff I'm really passionate about, as I know Dr. Mallory is as well. But let's start with what your qualifications are. What makes you such an expert you can come on to our show and enlighten our viewers?
So my education started with a nursing degree in dietary nursing in Czechoslovakia. And after I came to the United States, I went to University of Nevada, Las Vegas, and got a degree in science, a bachelor degree in science, cell and molecular biology. And after that, I went on to studying at the University of Southern California in Los Angeles, studying Doctor of Dental Surgery. And since then, as years went by, I have become an active member of International Academy of Biological Dentistry and Medicine and International Academy of Toxicology, yes, IOMT. And I'm currently being in the process of certification to become a biological dentist. But I practice biological dentistry right now, yes.
What exactly is a biological dentist?
Yeah, and why did you convert?
Well, so I converted because over the years I've had some patients declining fluoride treatment, for example, and also wanted me to remove mercury amalgam fillings out of their mouths. And I was hesitant at first because the science that they taught us in dental school was saying that those are not only safe, but fluoride being very effective in prevention of dental caries. And so when somebody declined a fluoride treatment, for example, I was perplexed by it. And so I started asking them questions. Why are you not wanting the fluoride treatment? And some of the patients did share with me that they're concerned about it being toxic. So after hearing that enough times, I had to look into it. And I started looking up studies online. And I was shocked and blown away to find out that fluoride indeed has been singled out as a neurotoxin, carcinogen, and hormonal disruptor. And I was in denial for a long time. I was afraid that this is not going to be accepted in my professional community. I didn't know how this was going to be accepted by my patients, but eventually I made up my mind based on looking at the science that there's something off here. So eventually I experienced crisis of conscience and couldn't really continue practicing dentistry the same way anymore, knowing at this point that I could potentially cause long-term degenerative disease or neurological dysfunctions. That's not why I became a healthcare professional. And so eventually I decided that it was time for me to really change up things and change how I do things, and in particular to remove fluoride out of my practice completely, which was an undertaking because they do put fluoride in a lot of the dental materials, whether it's sealants, whether it's composite resin, restorative material, whether it's crown cementation type of materials, sealants. And so I had to clean that up, knowing that this could cause a major health disruption down the road. And the next thing on the chopping block was really the mercury amalgam fillings. The International Academy of Oral Medicine and Toxicology, they have really published a lot of primary research literature or studies on the fact that it's very detrimental to the human health. And especially the brain is very sensitive to this. And I realized the way that we have been placing them and removing them is very unsafe. It really can release unsafe levels of mercury that the patient then can swallow or breathe. But also, while the amalgam filling is in patient's mouth, it also releases mercury on a microscopic level, and it off-gases. But also, if the surface is stimulated through chewing or brushing or clenching, grinding, there are microscopic droplets of mercury being released.
So are dentists who still place these amalgams, are they instructing their patients to not chew or grind or generally move in any way, shape, or form?
None of that.
No.
None of that. When I was in dental school and we had a lecture on the dental materials, the professor actually did say that American Dental Association is aware of the mercury being released throughout the life of the filling, and but the amount of mercury is so negligible it has no effect on human health. So that's what we were told, and yet the World Health Organization has gone on the record in 2009, I believe it was, that there is no known threshold of mercury exposure below which symptoms do not occur, which really translates into a statement that there is no safe level of mercury. So you've got American Dental Association saying that there is a release, but the amount is so negligible, has no effect on human health. But you have the World Health Organization saying that there is no safe level. And on top of that, you've got the EPA, Environmental Protection Agency, that just started mandating amalgam separators to be installed in dental offices precisely because of this, because we do drill out these fillings out of teeth if there is a work to be done on a tooth. And so this sludge gets released into the wastewater, and then it ends up in our oceans, basically contaminating the environment and fish. So EPA, I'm glad that EPA is doing that, but EPA is basically stating that whatever comes out of people's mouths, that amalgam sludge, that is a biohazard, is an environmental hazard. But while it's in the patient's mouth, for some reason it's not being treated as such. But also just prior to being placed in the mouth, or when it's being placed in the mouth, any sort of little shards of it, we, even in dental school, we had to dispose of according to the guidelines. So it's being treated as an environmental hazard and biohazard just prior to placement in people's mouths, and also just after the placement in people's mouths. But while it's in the people's mouths, for some reason, this is not being looked at as a biohazard or environmental hazard.
Yeah, that really stuns me. Like, they're admitting it's a toxin, handle it like toxic waste beforehand, handle it like a toxic waste when you got to clean it up. But boy, it's the go-to when you want to implant it in someone's body. It's absolutely insane. And I'm assuming the study you're referring to was back in '97 when they reevaluated this because controversy was coming up. And why do you think that the ADA is clinging? Because I read somewhere that the United States is the last first world country to still implant a mercury amalgam fillings. Why are we so tenaciously ignorant?
Well, I think there is a blatant conflict of interest because American Dental Association Foundation has held 2 patents on the dental amalgam fillings. At least one of them has expired, but these patents have been held over a period of decades. And I think at this point, since American Dental Association has been maintaining that they are safe and they're effective, I think they might be looking at a potential massive class action lawsuits or any such number of things. Also, just kind of wading through the data being published on the American Dental Association, you really can't help but realize that the American Dental Association is really there to protect the financial interests of the industry and not so much the interests of the patients, and also the dental personnel that is working with this incredibly toxic substance. As you probably know, mercury is the most highly toxic substance on Earth known to us, only second to radioactive plutonium. And these amalgam fillings, even just now as I was reading the American Dental Association information being published on their website, it plainly states that the amalgam fillings are, half of it is liquid mercury by weight. You basically mix liquid mercury with other metals, the powder. It's a powder composed of several other metals, such as silver. And that's how the amalgam filling got its name. Not only that it's silver looking, but there's a silver content, but the silver is only 10%. And
Right, but it sounds better to call them silver. I'm reminded Dr. Oz even did a show where he literally had people with amalgam fillings open their mouth, and with a sensor, you know, a sophisticated mercury sniffer, if you will, he could put it in every single person's mouth and in that moment measure the outgassing. So this isn't theoretical. We know that they're outgassing. We know that they're mechanically degrading, just like, you know, any metal would, except we're swallowing and breathing the tarnish, both which negatively affect our biochemistry in different ways and in awful ways. But
How accepted is this idea amongst the whole community of dentists? And what I'm thinking of, if you are sitting around at a conference with friends and you're just talking, you're not going on the record, do they agree with you but won't do it because it'll hurt their practice, or they might lose their license, or do they just don't have a clue?
It's mostly that they don't have a clue. When I went to dental school, our class size was rather large, 130, 140, 150 students. And now looking back and still being in touch with many of them and being friends with many of them, I think they are good, caring, ethical professionals that are simply trapped in a bad system. Because when you again go back to the curriculum and the way it's presented in dental school, it's presented as a fact, and they make a point of repeating these quote unquote facts, and the professionals do believe in it. And so yes, once I kind of start talking about mercury toxicity or fluoride toxicity right off the bat, I get the sense that I'm being viewed as, tinfoil hat wearer, a quack,
Yeah, well, I have a couple extra tinfoil hats in the corner there.
yeah, we stock them. But that's the thing I think I admire about you, is that you are kind of loyal to no one except the science and your conscience.
I think she's loyal to the patients.
And
I'm loyal to the patient. I'm loyal to the patient because this is the idea of the Hippocrates Oath. I pledge my allegiance to the best interest of my patients first and foremost. And I want to see the science. And if I see irrefutable science showing me otherwise, there might be a crisis of conscience, or there might be fear, but ultimately I resolve to fearlessly protect the best interests of my patients.
So we could do a whole show.
We have to expand the idea of what science is. Science has turned into a cult, and science is observation. You're observing what happens to your patients, and then you say, well, I don't like what's happening. Let's see if I can do it differently. We seem to have forgotten the idea that science is what we observe, and can we turn it into something that makes sense in terms of greater health? And, because the astronauts used to say, no bucks, no Buck Rogers. Funding for research is based on getting a certain result of who's paying for it.
That's right. So you have the official science, quote unquote, as it turns out, most of it is completely fraudulent. And the legitimate science is being willfully suppressed and silenced.
Well,
it's coming down from the top.
When you say that, I can hear some people saying, oh, okay, that sounds a little tinfoil-y. That sounds a little conspiracy theory. But what shocks me in preparing for the show and looking through international data, we look like the outlier. The rest of the world is very well established. They have a clear understanding of not only how dangerous mercury is and how ridiculous it is to implant in someone's body, and have either outlawed it outright or made moves to phase it out, outlaw it. But they understand the level of toxicokinetics, how mercury damages the body. And here we are still implanting it in kids. It absolutely boggles my mind. We could do a whole show just on mercury. The reason why we're talking with you is because mercury, among many other things, really can affect someone's mental health. It's something I screen for in every patient. But let's go back to the fluoride for a minute and tell me some of the negative health consequences people don't know about fluoride.
So fluoride is a hormonal disruptor. It is a neurotoxin, and it's a carcinogen. And it incorporates not in teeth only, but it also when it's systemically ingested, it incorporates into the developing tooth structure. But it also incorporates itself into the bone structure, and in a long term, this toxin basically bioaccumulates in those areas, in those bones, and make them brittle and really susceptible to things such as hip fracture later on in life, because the body doesn't have a very good way of clearing these toxins out. So there is a bioaccumulation effect, and when certain threshold is reached, which is very individual, that's when we can start really seeing the manifestation of those effects. But because it's a neurotoxin, there are studies that are showing that it also affects the intelligence and lowers the IQ, which makes sense because fluoride is a neurotoxin. So it would stand a reason that it eventually is going to also affect the intelligence, but it also is deposited in the pineal gland, for example. So, as we know, pineal gland regulates the circadian rhythm, the sleep. So, a lot of people have insomnia, for example, and I think that we should be looking at these environmental toxins for sure, and fluoride being at the top of the list.
Well, and what's interesting about fluoride is this isn't just a microscopic thing. We think of fluoride in our water or fluoride in our toothpaste, but we can't really see it. Mercury, you can see. I can open my mouth and show you amalgam filling if I have one, which I don't, thanks to Dr. Mallory. But the fluoride, there are macroscopic changes. I have seen totally calcified pineal glands. I'm just deciding if this is appropriate. One of my cadavers in medical school had a honey of a calcified pineal gland, so much so that all the other med students ran over to look at the thing. And we were taught, we don't know what causes it. But interestingly enough, they tell you very little about your cadaver, because you're supposed to figure out how they die. But they'll tell you demographics, their age, their sex, and their profession. Coincidentally, you know what my cadaver's profession was? He was a dentist. And he had
Wow.
the most heavily calcified pineal glands that, our lab person had seen. And I always bookmarked that, and it makes sense. It certainly makes sense now. What about, what would you say about other restorations, like root canals, let's say?
So root canal therapy, it's a procedure that is being used when a tooth has been abscessed or infected or damaged to the point where the internal part of the tooth is basically damaged. The internal part of the tooth, that's your nerve bundle, that's your blood supply to the tooth, your lymphatic system in the tooth. Tooth is actually a delicate organ that houses this live tissue within the center of its tooth. So once the either trauma or bacteria enters this area, this is basically the beginning of the end for the tooth. That's when people a lot of times will get a toothache. And so the root canal therapy is the way to preserve the tooth and not have it removed, having it extracted.
Tell me the dark side.
The dark side is the fact that you cannot really sterilize or disinfect the tooth completely, because the internal part of the tooth is so complex. You've got the root canal system, you've got the visible root canals that are visible on the x-ray and easily accessible by a dentist, but you also have the accessory microscopical canals that are not visible, and in between them are dentinal tubules. So the tooth itself is very porous, and it really is a perfect breeding ground or petri dish for bacteria to really survive and propagate. So when we do a root canal therapy, and I have done 10, 12 years worth of doing root canal therapy, so I know how it goes. We do use a bleach solution to try to disinfect the tooth from the inside. We instrument the canals and remove all of the soft tissue, diseased tissue, but there is a diseased tissue that is logically left behind because of these microscopical dental tubules, and accessory canals are simply not accessible. They're not accessible to instrumentation or the disinfecting solution. So Then we restore the tooth, put a crown on it, or what have you.
Well,
but
wait a minute. There's a step before that, not to tell you your trade, but the part that fascinates me is some people pack that cavity, right, with something called gutta percha, correct me, I don't know what I'm talking about. But in some cases that can contain biocompatible materials, sometimes even mercury itself for radio opacity.
Yeah, mercury
X-rays.
amalgam is used in an endodontic procedure called apicoectomy, where maybe a tooth received a repeated root canal therapy and it failed over time. So then the surgeon will go in and will amputate the very root tip of the tooth and will pack amalgam in there. And this procedure is not being used in modern dentistry as much anymore, but there are still practitioners that are doing that, you know. So yes, the biocompatibility of materials is a truly big issue, and even the disinfecting solution of the bleach or medical grade household bleach, you know, that is a neurotoxin as well. So in dentistry, we do have a tendency to use very toxic materials. And a typical biological dentist will actually send patients for what's called a dental material biocompatibility testing, which has a lot to do with the immune system.
It's brilliant.
Yes, yes, and I think it's a must, especially in people that already have a diagnosis of, like, let's say, autoimmune disease.
Mm-hmm.
You know, everybody's health status is different. Everybody's genetic makeup is different, and some people will detoxify a little better than others, and some people will have a reactivity to certain materials and other people's to other materials. So, you know, we have found the cleanest materials that we could possibly find. In my practice, for example, our composite resin does not contain fluoride or the plasticizers known as BPA and BPB. So we have sourced the cleanest ones that we could find, and we still maybe have a choice between 2 or 3 materials that we can use, and we decide based on the results of the dental material biocompatibility testing, so that we do not provoke that immune system to
Sure. And I mean, it's more than just biologic dentistry, it's personalized dentistry, because you can check each patient for biocompatibility or reactions. Like my oldest daughter is pretty highly allergic to nickel. If she ever got braces or got, you know, a retainer or something like that, it has stainless steel, which contains nickel. She would have a serious reaction to it. I'm sure you see all the time. But the problem is nobody asks, except biologic dentists, that nobody thinks about this ahead of time.
No, because number one, this is not being taught at all in dental schools. And dental schools to this day, they teach amalgam placement. They teach the techniques of amalgam placement. And in fact, if you want to take a state board exam and become a licensed practicing dentist in the state of Florida, for example, but it's across the United States, you have to demonstrate on a live patient a competent placement of amalgam fillings. Which really is a big predicament for some of the dentists that want to move out of state, want to maybe move to Florida. They've been practicing biological dentistry for a number of years, and they really cannot go to Florida unless they're willing to place amalgam on a live patient for the purposes of passing that dental state board exam.
That's awful.
Mm-hmm.
Implants. We've been talking a lot about biology. Tell me about some of the energetics. We've talked about energetics on the show before, and I'm fascinated. You know, I think of like the Chinese and each tooth corresponding to a meridian. What happens when you go in there and you implant a titanium, you know, receiver into someone's jaw?
Yes. So definitely it can have a profound effect on the human body. First of all, I don't think dentistry should be treated as type of a branch of healthcare where the mouth is not even connected to the rest of the body. The mouth is connected to the rest of the body, and even the science of embryology shows that teeth develop from the same cluster of embryonic cells as the internal organs, for example.
Mm-hmm.
So even the mainstream science is really pointing in that direction of things being related to each other, teeth being related to internal organs, for example. But in the Eastern medicine, this has been known all along for thousands of years, that there's this idea of energy flow and the idea of meridians. And I find that uncanny because if I see a patient that may have, for example, a breast cancer diagnosis, and just out of my own personal interest, I look at the teeth that are sitting on that meridian. More often than not, in fact, in a crushing majority of cases, they do have two or more either dead teeth, abscess teeth, or root canal teeth sitting on those meridians, you know. So there definitely is a connection. And so when we have infection sitting on that meridian or non-biocompatible materials such as titanium implant, it can really affect those organs downstream. But a lot of times that effect is not seen or known until certain passage of time. So at that point, nobody really puts the two together. But metal should not be placed in the mouth. I know some people say, what about total joint replacements? I'm here to talk about mouth, and there's a unique environment in the mouth where the mouth is bathed in saliva, all kinds of food with varying pH. You've got acidic food, you've got 500 plus different bacterial species living in the mouth, plus all the grinding and chewing. You know, mouth is a very tough, inhospitable environment, and things are getting easily released and pushed into the gum tissue or getting released into the oral cavity. So metal should not be used in the mouth specifically, not only because it sits on that meridian, but also because it sits inches away from the brain. So you've got the oral galvanism connected with the metals, and you've got the toxicity of the microscopical particles that are being released. So dentistry, if we really want to make it in line with achieving health, first and foremost, it should be metal-free. So with implants, ceramic implants is the way to go. Any removable dental prostheses such as dentures and partials, they should not be used with a metal substrate. Crowns and bridges should be zirconia and ceramic. We should not be using even so-called gold. The gold restorations, and really is not a pure gold. It cannot be a pure gold because it's too soft. So it's an alloy of all kinds of metals, and none of them are really biocompatible. And even if they were, we're still talking about the oral galvanism and how it affects the electron exchange along the nerve fibers in the surrounding nerve.
It's a micro battery there, and I mean, it's more than just. So what you're saying is those biocompatible materials that you just mentioned to large populations of people are much more bio-inert on average. But you actually can do specific testing on each patient if it's indicated to find out exactly what's compatible, how compatible, or what's less compatible and how incompatible. And to me, that's it's brilliant from where we're coming from, but it should be common sense in 2020. This is technology that easily could have been figured out in the 70s, 80s.
Well, you've done something remarkable, which is to get me to be quiet for a while and listen. I find the holistic approach that you have, putting it all together, really fantastic and remarkable. And I've had a lot of experience working with the emotions that are stuck in the mouth, and probably could do a whole show on it later. So I really, I don't even want to start asking you questions because we'll take another hour. I just want to let you know I was really listening, and you've got it right.
Yeah, she's one of the smartest, sweetest souls I've ever known, and I believe so strongly in what she's doing. And the science, coming from my medical background, completely supports it all. To me, it's incredulous that we are even having to have a debate whether these are healthy or not.
Yeah, you know, and it never made sense to me. I had my mercury amalgams taken out 20 years ago. You know, there was a biological dentist in town then, and I just thought it was silly. I mean, I didn't know all the studies. you know, this is my science. It's silly to have all that in my mouth. It seems stupid to me, you know, and I said, okay, well, he's in town. I'll get these things taken out. And I'm glad I did.
Well,
That's
yeah, and we, like you said, we could do a whole show on that. We could do a whole show specifically on Mercury. We'll see what kind of feedback we get from the listeners. But we just have about 2 more minutes. Real quick, explain to Dr. Schulman and me, what are cavitations and why are they important?
okay. So this is a very interesting phenomenon as well. Of course, when we're studying in dental school or oral surgery residency programs, they teach us how to extract a tooth. But there is a very important additional step that is not being taught nowhere, in fact. And I have talked to a couple of specialists in the field, and I asked them about it. Is it just, maybe I just don't remember, but they did confirm, no, this is not being taught. And that additional step is the removal of the so-called periodontal ligament. It's a fibrous tissue that holds the tooth attached to the jawbone. And when we remove the tooth, it sort of partially tears, but most of it stays in the extraction socket. And because it's a fibrous, dense tissue, it acts as a barrier, and it prevents the blood cells, you know, and also the bone cells. It prevents them from migrating into the socket and begin to regenerate the bone. So eventually it sort of heals over, but it results in an incomplete healing, and there's always that little void, however small, however big, that is retained within the jawbone. And unfortunately, these dead spaces, they're loaded with bacteria, because we cannot really achieve a sterile field in the mouth. When we do oral surgery in the mouth, there's no way to prevent the 500 plus different species of bacteria from migrating into the extraction socket. So these bacteria get trapped in there, and there's no oxygen that can reach them. So typically the environment shifts towards the anaerobic bacteria, as well as parasites such as amoeba. And they stay there. They're just there as long as the so-called cavitation is there. That's what it's called, cavitation. Another name for that is NICO lesion, or cavitational cyst. NICO stands for neuralgia-inducing osteonecrosis of the jawbone, cavitational osteonecrosis of the jawbone. And so the immune system, however, is perfectly aware of the fact that there is a problem in that area of the jaw. So the immune system is kind of forced into an overdrive, because it's constantly wanting to fight that invasion of the infectious agents, right? So,
and this fight can last for years, right? I mean, this is a chronic simmering infection.
That's right. And because of the immune system is in a state of emergency on perpetual basis, it's already been shown that it can cause autoimmune disease, for example, and cancer, because cancer is really, what it boils down to is a disease of the immune system. So these are very carcinogenic. They're provoking the autoimmunity, and really, they really act like, those cavitations act like a root canal or abscess tooth. Typical biological dentists, when they revise these areas of previous extractions, they will actually remove the material from that cavitation and send it to a special lab that analyzes the DNA of the microorganisms, and we get the reports on that, and it's always a laundry list of all kinds of bad bacteria that just has been living there in a perfect environment, undetected, basically. So we do revise those areas. A lot of the biological dentists will revise those areas, meaning open it up, remove the material, clean it out really well. Ozone gas and ozonated water is being used extensively. Ozone gas having a very high disinfecting power. And then also, we harvest patients' blood and put it in the centrifuge and generate what's called PRF, which is a platelet-rich fibrinogen, which is basically a concentrated plasma that has lots of stem cells in it, growth factors, and also white blood cells that fight infection. So it's derived from the patient's own blood, and then it's put in this cavitation after it's been cleaned out and disinfected with ozone and sutured over. And that really promotes the bone to heal that cavitation and fill in with its own native bone. So this is how it's remedied.
And eliminate the loci of infection.
Eliminate. But
Wow.
the most important thing is that this information gets shared so that dentists and oral surgeons make sure that they remove this periodontal ligament. And that's the problem that we see in the industry right now, where this knowledge is not being shared. And the practitioners, the dentists, oral surgeons, they really have no idea that this phenomenon even exists.
Well, I am going to make sure to put a link in the description of this video to a documentary called Root Cause that you can purchase actually on YouTube right now, which goes into a lot more of the patient's experience of the sick and suffering as a result of all of the things Dr. Mallory has talked about. And we will definitely have to have you back on the show again. I know we covered a lot in a little bit of time, but I think it was really important and really exciting. And we really appreciate you coming and doing this.
I appreciate you being able to talk about these complicated things in a way that I can understand it.
Yeah.
Thank you. Thank you very much for having me.
All right.
You're welcome. It was very nice to have you.
So until next time, remember, be well.
We almost got it that time.
Almost.